So hello, my name is Briody. I am based here in the Geary Institute in UCD as a Sphere Scholar funded by the Health Research Board, and I'm currently completing my PhD in Health Economics in the School of Economics in UCD. My supervisors are Dr. Orla Doyle and Professor Cecily Kelleher, and Dr. Kevin Denny is on my doctoral studies panel. So my research focuses predominantly on the importance of economic change for changes in health, and today I'm just going to talk very briefly about a study we completed recently on the effects of the Irish Recession on the health outcomes and behaviours of Irish mothers. So in the current literature, recessionary effects are often examined only in those who experience direct employment change. So the focus of prior research has largely been based on working men, as mothers traditionally have variable degrees of labour force participation. So this is particularly important in light of emerging evidence which demonstrates that individuals' employment status only partially captures pathways through which recessions may affect health outcomes and behaviours. So in examining the determinants of health outcomes and behaviours during recessions, the current evidence suggests that rather than the individual's actual employment status, it is the area-specific unemployment rate that is most important. So particularly the evidence from these studies indicates that the use of local area unemployment more proximately captures the effects of recessions, because within area changes in the unemployment rate reflect other macroeconomic factors in the area. So there are changes in psychological well-being and community level effects on health outcomes and behaviours due to the increased probability of unemployment and the effects of increased unemployment in one's local area. So these are things like antisocial behaviour, social cohesion, crime, things like that. So considering local area unemployment provides a reduced form estimate of the net impact of the recession on individuals' health outcomes and behaviours operating through all individual and ecological channels of effect. So as informed by this developing literature, this study combines employment measured at the Irish county level with health measured at the individual level. So this study uses panel data from the Irish Life-Based study to investigate the impact of the Irish recession on health outcomes and behaviours in mothers using fixed effects regressions which control for individual specific effects. So the Irish Life-Based study is kind of ideally suited to this kind of analysis, being a familial birth cohort measuring 3 generations of the same family before, during and after the beginning of the Irish recession. So the results of this study are that increases in local area employment are associated with significant increases in the probability of reporting poor mental well-being, and self-assessed health. As unemployment increases, the probability of obesity and cigarette consumption decreases, and we find that mild exercise increases while strenuous exercise declines as local area employment increases. The effects on alcohol consumption were completely non-significant, and basically we applied several robustness checks and extensions to these original analysis to kind of cement what we found. So these include inverse probability weighting to test for issues of missing data or attrition, and a falsification test to investigate the probability or the possibility that inherent non-recessionary differences in area-specific macro-social characteristics are driving changes in health. And these all failed to change the results of our study, which is encouraging in terms of our contribution to the larger literature.